I wake up every day. It's like the sports agent in Jerry Maguire at the beginning when he's sitting at his desk and he is, I'm ready to face the day. That's how I feel every morning. I feel blessed to wake up and go to work. I love what I do. I love helping patients. I love being able to provide a unique level of care. I love being able to use the minimally invasive techniques that we use. I love being able to have patients present with complex problems and find simple solutions. If you said, what is it that I do differently? That's it right there in a nutshell. People come to me with very complex problems. I can see where I want the final result to be, and I can find predictable, simple solutions for how to get there. And unfortunately, a lot of times in dentistry today, people don't see the solution before they start, and they take a lot of extra turns that don't always go the right way on the way there. It's interesting. I think, practicing here in Boston in an extremely strong economic environment compared to some other parts of the country, number one. Number two, in an area where, for whatever reason, dentistry has become very expensive, very costly. Dentistry really has become very costly if you look at the urban Boston area. We have very few patients who present major concerns with the fact that we run a fee-for-service practice environment. I think most patients greatly appreciate the service we provide and the way we do it as a team, and they understand that it would be very challenging to do that in an insurance-based practice. It would be impossible. The practice I took over in 1999 accepted at that time just Delta Dental Insurance, and we gave that up, I think, in about 2012. And at that time, some of the changes just made it impossible to keep doing it. And we had a few patients leave the practice, but very few. Number one is communication and trust. And there has to be communication. Patients have to be well informed of actually understanding what's wrong diagnostically and what the solution is, and agree that that's important to them and be committed to it. The next is empathy and compassion, leading the way and caring for people as I'd want to be cared for myself. And that involves how we're working, what we're doing, what the result is, choosing a pathway that's going to be predictable for that individual patient. I think the other side is personalized care. It's a very personalized process deciding on what treatment is right for each patient. And two patients could have the same diagnostic problem but need very different solutions. It has to be personalized. Personalized medicine is critical. And it's not just a term of, if someone had some type of disease, finding out exactly what that is in some personalized drug. It's much more than that. It's much broader than that. Given that my practice is generally been a tertiary care practice for a lot of my career, we see many patients for second or third opinions, and a lot of patients who have had limited care in the past because of anxiety, or have started treatment and stopped because of anxiety. So this is a common theme that we have to work through with patients. And again, it's very personalized, meeting each patient where they are. Some patients need a lot of time before they're even comfortable going through a limited exam to see diagnostically what's wrong, and figuring out the right solution for each patient to manage their anxiety. And some patients is just educating them and getting them comfortable on a one-on-one working relationship with the doctor. Other, it's what the process is going to be, whether that's with some anxiolytic medicines or with sedation procedures.